July 5th, the new National Health Service starts, providing hospital and specialist services, medicines, drugs and appliances, care of the teeth and eyes, maternity services.
In 1948, the National Health Service was founded by Bevan so that people would never again fear that their purse would be felt before their pulse. But as we celebrate its 63rd birthday, the future of the NHS is far from certain. With a government determined to impose its health and social care bill, the NHS is facing its greatest crisis. Even though the NHS is performing better than ever, this government has set out the biggest upheaval since its birth in 1948. At the same time, the government is implementing so-called efficiency savings of £20 billion over the next 4 years. That's 25% of the NHS budget. Despite the government's pre-election promise not to break up the NHS, its current plans will mean a huge reduction and rationing of services, with tens of thousands of staff losing their jobs.
David Cameron's breaking his promises. The promises he made to the British people before the election about protecting the NHS, about giving it a real rise in funding, and above all about not reorganising the NHS. Now, he made those promises before the election and he's breaking them now.
And those broken promises mean that unless you can afford to go private, everyone will suffer from the cuts.
I feel that when Bevan started the National Health Service for the people of this country, it should stay that way, because it was a wonderful thing. How many countries in the world have got the facilities that we have, and it should be left alone. Nothing to do with money. It should be left for the public.
I'm the age when I remember, like, when my parents had to pay to go to a doctor, right? People never went because they couldn't afford it, so then people died. And in them days there was diphtheria, scarlet fever and all that, and lots of kids died because for the want of calling on someone free.
We're working longer hours and we're actually working more hours without a break, and a lot of after-shift overtime, so the cuts are actually meant to save money, but they're actually increasing the money in after-shift overtime.
It will mean that the children and families that I work with won't be able to afford to access healthcare.
I think that for healthcare professionals, they will be running around in circles because they will be having to compete with everybody else in order to win contracts, to win money to provide their services. And instead of the NHS being a service that concentrates on providing services to public, it will be turned into a service that chases profit. And this is absolutely against what the NHS stands for.
It's piling huge extra pressure on staff and on services, and it's those services to patients that will start to suffer, because we've got the biggest ever reorganisation in the NHS's history and also the tightest financial squeeze. And that's what makes this wrong. It's what makes it reckless before you even get to the changes they want to see.
My fear, if this bill goes through, is that we will see what the NHS provides for you and me shrinking. And we will see top-up payments introduced into the NHS so that the poor get a safety net service provided by the NHS and the more affluent can buy extra add-ons to the health service. That is why we must make sure that the government retains responsibility for a universal, comprehensive health service.
Right across the country, people are fighting hard to retain a universal and comprehensive health service. As Bevan said when he founded the NHS, it would thrive as long as folk were there to defend it.